Workers on the front line of New Zealand's border, airport and isolation and quarantine facilities should get unlimited sick leave to help keep COVID out of the community, according to a university professor who studies the spread of the virus. Shaun Hendy is one of the authors of a paper looking at how to minimise the risk of coronavirus getting through our border. And he considers those frontline workers one of the biggest risks when it comes to another outbreak. He's calling for a once-a-week COVID tests for all border and isolation workers. I asked Professor Hendy just how exposed we are on the front line.
If we kept the current quarantine going, then actually we could maybe have one case in 18 months that made it through the border that way. So what are the other things that we could look at? And so obviously now you start to think about, people who are working at the border, who are coming and going. They might spend time at the facility, a security guard, and then they're going back into society. And so it's a small risk, but it's a significant one. And of course we know, or at least we think that's what happened in Melbourne and Victoria. Maybe just one or two interactions between workers and infected people who were isolated that led to the big outbreak. So it's kind of one of those things that it's a relatively low risk, but it remains for us, and it can very quickly spiral out of control, as we've seen across the Tasman.
Okay, so let's talk about how we minimise that risk. In your view, given your modelling, what is the ideal testing regime?
Yeah, so we think a weekly test is the best way to do it. I mean, they're not pleasant things, the tests, and you don't want to discourage people from taking them by giving them too many tests. So we think a weekly test that actually greatly reduces the risk, followed by some symptom tests, right? So checking in with workers maybe every day. What have you got a cold? Have you got any of the classic symptoms of COVID? And if so, then a follow-up test, and not allowing, and isolating that person at home. And so with that actually greatly reduces the risk of that case coming outside. It's about reduces things by about 90%.
90% it reduces the risk if you test those workers once a week.
Yeah, and have symptom checks, and that's relative to no testing and just worker awareness. We assume that people who are working in these facilities are being briefed and are being told to look out for symptoms, so they'll probably be more aware than most of us of what to look out for. So it's relative to just that general awareness.
So you mentioned earlier that potentially you could get one case every 18 months in terms of coming through the border. Was that just a random number you used then, or have you got some kind of modelling that suggests that would be the case?
I've been doing modelling of how well that quarantine period works and how well the testing works. Problem with the tests is that they don't always show up. There are some people, it might take 2 or 3 tests before they show positive. Some people, maybe never show up as positive. So the test is not perfect. So it's about reducing risk with tests rather than relying on tests to be perfect. And of course, there's the odd case where you can be infectious over more than the quarantine period. 99% of people will have passed through the course of the disease, of their infectiousness during that 2-week period, but there's still a tiny risk that could get through. And given the volume of people that are coming through, that translates into about one case coming through into the community every 18 months.
Okay, so in terms of your modelling, what is the possible scenario of spread if you get one frontline worker at the border who is positive?
Yeah, so the thing that we're really worried about, I mean, if we find if a worker returns a positive test, that's actually, that's a good outcome in some ways, because we've caught it in that individual before they've gone on to spread it perhaps to their household contacts. And the risk is, of course, that we don't detect it in the individual, either because the test gives us a false negative, or because we're not testing frequently enough, and then it gets passed on through the household contacts. So people who live with frontline workers need to be aware of that possibility, or it could come out into the community. It could be a casual contact, a contact in a restaurant or a bar or on a bus, or an environmental contact where you've picked it up off, the virus up off a surface. And so in that case, that's what really concerns us, because once you find, if you find it in the environment, if you find it in a casual contact, that means maybe there's 10 to 15 other people who've been infected in that period.
Again, that 10 to 15 number that you use is from your modelling. If we pick it up at the point where a community contact of the infected border person has it, there's likely to be 10 to 15 other people who have it too.
That's right. That would be the average size of the outbreak at that period if we see it in someone who's not at the border.
So, in this document, you talk about the thin line of defence at our border. In your view, currently, with the checks and balances in place, how thin is that line of defence?
I think we've got to remember we're in this for the long haul at the moment. We're looking about a plan that we have to keep in place for maybe a year to 18 months until we see a vaccine on the horizon. So it's something that we've got to maintain for a long time. It's got to be sustainable, and that's going to be a hard thing to do. I think it's worth resourcing well. It's worth us paying attention to, and it's worth us working continually to improve it and get it right.
So at the moment, as I understand it, they do health checks with the workers. Are you feeling well today? Do you have any cold symptoms? All of that kind of stuff. And also what I would, in lay people's terms, could call random testing. So have they given you any commitment to go to once a week testing for all of those workers on the front line?
We haven't had a commitment on that yet, but it's being considered at the moment, I believe.
How well do you think the government appreciates the vulnerabilities that you've pointed out at the border?
No, I think these are well understood. They're juggling things like the logistics around doing this, and there is some concern again about the fact that if you are a border worker, maybe you've used up your sick leave. You might just not mention the symptoms. If you realise there's a risk that you'll perhaps be sent home, or some of your family members might have to not go to work for a couple of weeks. So I think that we've got to take that into account. We've got to look at making sure we're supporting people, supporting these families that are working at the border. They're doing an important job for us, and we should be looking after them.
So, Shaun, does that mean, in terms of looking after them, if you're in a frontline job at the border, should you get more sick leave then?
Oh, absolutely. Yeah, no, definitely. And even if you're living in the household of a frontline worker, I think you should be given extra consideration and some financial support for quarantining.
And what would you think would be reasonable for sick leave then?
Look, you've got to. Every time, I would say this is not something you can put a quantum on, right? This is possibly something that people are going to have to do several times over the course of working in a frontline role. So there shouldn't be limits on it. If your workplace requires you not to be there because you're exhibiting symptoms, then you should not be there.
So in that sense, you're suggesting unlimited sick leave because that is part of the cost of protecting the country.
Yeah, no, absolutely.
Hey, Shaun, just curious, would you be comfortable working at the border?
I think I would. I'm someone who's been looking at this disease, and I'm sort of relatively well informed about the ways that you can protect yourself. And I just like everybody, border workers in particular, to be aware of those things. And so it is important for us to talk about this and raise awareness of the risks.
And that is Professor Hendy. He says he's been talking to the government and will speak to them again next week about his recommendations. And as you heard there, he's suggesting that those frontline workers be tested at least once a week to reduce the risks of COVID getting into the community. Now, we asked the Ministry of Health about that. It says it prioritises testing for those working at the border, including workers at managed isolation and quarantine facilities. There is a program of daily health checks, and any staff member who reports symptoms consistent with COVID-19 must stay at home, get tested and self-isolate until they receive the result of their test. The Ministry is also undertaking regular asymptomatic surveillance testing of people working in border-facing roles, including those at managed isolation and quarantine facilities, particularly those who have direct contact with international crew and travellers. And they say there is testing available on site for staff every 2 to 3 weeks. Now, the ministry says it will continue to review how often the tests are needed.